On the 21st of January 1965, Pastor Fritz von Bodelschwing's nephew and successor, Pastor Friedrich von Bodelschwing, argued as an expert before the Committee for Restitution in a similar manner, totally ignorant of our reality. Quote, "If one were to grant the sterilized people a right to compensation, this would cause only unrest, considerable new suffering for these people." Unquote. Bethel kept on sterilizing patients long after 1945. Last year, I received a call from someone telling me that Bethel had pressured them to have a sterilization even in the 1970s. If only theologians and psychiatrists would doubt their own worth for our lives. When some 60 asylum directors and psychiatry professors were informed for the first time about SS Führer Victor Brack's euthanasia program and Adolf Hitler's Berlin Chancellery in July 1939, all of them declared their willingness to cooperate in the killing of asylum patients, with the exception of Professor Gottfried Ewald from Göttingen. He explained his disapproval in detail. One single person, sound in mind and soul, among 60 professors of psychiatry and clinic directors? Where were their consciences, their courage, and their compassion? Values that turn people into fellow humans. In Berlin at Tiergarten Street 4, the experts and senior experts pronounced death sentences only on the basis of questionnaires that had been filled out in the asylums. In 6 psychiatric killing centers, those who had been sentenced to death were gassed. When Hitler responded to the protest sermon of the Catholic Bishop Clemens August von Galen in Münster on the 3rd of August 1941 by ordering a stop to the gassing on the 24th of August 1941, the asylums took over and continued the killing by medication overdoses and by starvation diets. According to the latest research results submitted by the historian Professor Hans-Walter Schmuhl, nearly 300,000 asylum and nursing care home patients were gassed, poisoned, and starved to death. 80,000 of these were from Polish, French, and Soviet institutions. Considering that our politicians, psychiatrists, and theologians have since nearly completely repressed this most drastic kind of compulsory treatment in the form of killing people with so-called lives devoid of value, it is mostly left up to us users and survivors of psychiatry to preserve the memory of those murdered in the name of psychiatry in our hearts. After 1943, psychiatrists who had turned out to be adversaries of their patients, and in the period from 1939 to 1945 had proven themselves to be, in the literal sense of the term, their mortal enemies, continued to convey to their students and to the public only an image of deficiency of those who had been classified as incurable. Even on the 20th of April, 1979, 40 years after the beginning of the euthanasia program in 1939, the weekly paper, Die Zeit, ran these headlines on the front page: "A society of hard hearts in the snake pits of the German psychiatric system." In the article it is stated, "And no minority is treated as disgracefully as the mentally ill." The decades of backwardness of this kind of psychiatry could not be done away with, despite considerable efforts in recent years. It remains devoid of conversation and uses medication also under coercion and restraints, only fighting the symptoms instead of understanding. Sataria and Professor Yrjö Alanen's Need Adapted Treatment in Finland have focused on the experiences and needs of the patients for over 30 years now, by taking them seriously and giving immediate psychotherapy for those diagnosed as schizophrenic, absolute priority over antipsychotic medication. In contrast, the German Society for Psychiatry, Psychotherapy and Neurology, DGPPN, assigns just 10 out of a total of 140 pages to the topic of psychotherapy in their draft version of Treatment Guidelines for Schizophrenia. The only method they approve of is cognitive behavioral therapy. But even this, they emphasize, only when pharmacological therapy has failed. Today's German psychiatric system has adopted amilocriptlin's hereditary or genetically caused and therefore meaningless brain disease almost without change, except for using a different label, now calling it a disorder of the brain metabolism. Antipsychotic medication has existed since 1953. Since then, its immediate application is the method of choice. A patient who is overwhelmed with his psychotic experience, of course, wants to be taken seriously with his experiences and wants to understand them. The immediate sedation with strong antipsychotic medication is not recognizable as well-meaning help from the patient's point of view. He or she will resist. To make them compliant, they will often be strapped to the bed by the hands, waist, and feet, restrained. At the first Psychiatric World Congress in Germany after the Second World War, 1994 in Hamburg, jointly organized by Dr. Thomas Buck, together with our Federal Organization of Ex-Users and Survivors of Psychiatry, the Federal Association of Relatives of the Mentally Ill, and the German Society for Social Psychiatry. The artist Jutta Jentges exhibited a large, impressive painting with a person whose arms were spread up over the head and the feet were strapped to the bed with the question, why? Why? She depicted the suffering of being restrained even overnight. The restrained person has been equipped with a diaper. That, too, is experienced as a humiliating debasement. For many people who have had the agonizing experience of restraints, it sometimes remains a lifelong trauma. At the time of my 5 stays in psychiatric institutions between 1936 and 1959, this agonizing way of tying patients to the bed by the hands, feet, and waist did not exist yet. Just very rarely body belts were used. Up to my 4th episode in 1946, it was common practice to wait a few weeks to see if the psychosis would recede of its own accord before metrazole, cardiazole, insulin, or ECT were applied. In 1936, these shock treatments also were not yet available. During my last psychotic episode in 1959, I experienced for the first time that all of us in the ward were immediately injected with high dosages of antipsychotic drugs. I considered this total dictatorship, which no longer allowed us to think and feel, and also caused major physical weakness, deeply repulsive. I was lucky to develop a skin rash after the first 2 days, and so from then on, pills were shoved into my mouth. Each time I hid them under my tongue and disposed of them in the toilet. Nonetheless, it took me the same time as my fellow patients to be rid of the psychosis. Nowadays, liquids are used, which have to be swallowed instead of pills to prevent behavior like mine. In contrast, how much more helpful, respectful, and competent is the Krisenpension, crisis guest house in Berlin, staffed in a trialogue manner. Staff consists of psychiatric survivors, family members, relatives, professionals, and laypeople, and they work without using any kind of coercion. Here, the psychotic patient and his experience is taken seriously, instead of being reduced to having a disturbed brain metabolism.